everyone, and welcome back to our Mother's Health podcast. And this is a podcast where we share the hidden stories behind the maternal death statistics. We challenge harmful practices and we advocate for women's health and safe motherhood. I'm Dr. Vivian Chinwa and I'm the host of the podcast. In this season 2, we start a very important theme. And this is a theme that affects all women, regardless of your location. It affects women in the United Kingdom, in developed countries, and also in developing countries. And it cuts across cultural levels. And this is called the Superwoman Syndrome. This is not a medical condition, but it's a social condition, I would say, where women feel I'm fine during pregnancies. I can do it all regardless of the warning signs. I can endure. I can walk until 9 months and ignore all warning signs. And the reason why the Superwoman Syndrome is still predominant in our society, in our culture, is because women are being praised when they carry their pregnancy with strength and they walk through 9 months. These are women that say to themselves, I'll rest after delivery. But millions and millions of women have made these same statements and it ended in tragedy. Women are praised for their endurance skills, for their silence, and for in the pregnancy with so much sacrifice. This is where women walk through pain. They ignore all the warning signs. They delay seeking care. They carry financial, emotional, and caregiving burdens. It celebrates women that push through this. But pregnancy is not a test of resilience. It's a psychological state that requires rest and timely care. According to the World Health Organization, 280,000 women die. A majority of women in these statistics are women that delay seeking care. And why do women delay seeking care? A lot of times because they want to appear strong, walk through the pregnancy, they want to be applauded for their strength. And in many cases, women complain. Complaints are being dismissed simply because they're expected to be strong. And a lot of women in this situation are single mothers, women with low-income jobs, women from minority backgrounds, migrant workers, people with visas. Okay, want to work because they want to make ends meet for their family, and they ignore all the other warning signs. A woman walked through her third trimester, continued working late shift because she was her family breadwinner. She noticed headaches, swellings, but dismissed all the signs. She didn't want to complain. No, because she didn't want to also appear weak. We look at the social media platform, we see women dancing with pregnancies, appear very strong and healthy. I read through this comment and I say, what a strong woman you are. But one woman is different from another. And in this second season, we'll redefine strength, what strength means for women during pregnancy. Women are taught that rest is laziness, that asking for help is weakness, pain is normal. Motherhood begins with sacrifice and suffering. Add poverty, add racism, add migrant status, add fate, add pressure of single parenting, and the burden multiplies. A lot of times for migrant workers or people from minority background, the super syndrome is often tied to survival. And the medical system and a healthcare practitioner, the doctors miss these opportunities a lot of times. One, by normalizing pain, by rushing through antenatal visits, labeling women low-risk without listening, discharging women too early. Now let's start by redefining strength. Strength in pregnancy is not about endurance. Strength is about speaking up. Strength is about resting. When a woman says, I'm managing, ask deeper questions. Strength is seeking healthcare early. A strong woman protects her life because her life matters. I remember just having my baby. I felt tired. I didn't understand what was wrong. I looked around and I saw other women seem okay. We were asked to go to the breakfast room every morning so we can do functional activities so we could be discharged. And a lot of women looked the part. Their hair made nice, lovely pajamas, and they looked well, they looked strong. They could walk to the breakfast room to have a breakfast. But my case was different. I felt weak and tired. And when I asked for someone to get me breakfast, I was perceived as weak. I tried to get breakfast every now and then, but I knew something was wrong, but I couldn't place my hands on it. Everyone thought she'll be fine, like everyone else. And I was discharged. I went home. And later in the day, the midwife came visiting because that's a practice in the United Kingdom. When you discharge, at some point on the day you are discharged, just to be sure you're fine, and which is a very good practice in the United Kingdom. So I was discharged, and by the evening, I was shivering. I didn't know why. I was still weak. And the midwife looked at me. She said, "You're not okay. You're shivering. Something is not right. You might have an infection." And I was rushed back to the hospital. Little did I know, my immune system had dropped. I had an infection and my blood levels were nothing to write home about. And this was the reason why I was weak, but nobody paid attention. Everybody expected me to be strong. Everyone expected me to be resilient in the face of everything I've gone through, because other people were strong. My complaints were dismissed and they thought I was lazy. The reason why I couldn't walk to the breakfast room was laziness, but in fact, it was arthritis. A medical system and the medical practitioner missed the signs because pain is being normalized in pregnancy. They rush antenatal visits. They label women low risk a lot of times without listening, and they discharge women too early. When a woman says, "I'm managing, I'm not well," do not assume she's being weak. A little more investigation. Ask more questions. Now let's redefine strength. Strength in pregnancy is not about endurance. Strength is in speaking up. Strength is in resting, and strength is in seeking care early. A strong woman protects her life because her life matters. In this second season, I'm going to be doing a lot of episode on the Superwoman Syndrome. We're going to call on women to listen to your body. Take your symptoms seriously. Ask for help without apology. If you love a pregnant woman, encourage them to rest. Remove the pressure. Advocate loudly when she cannot. And I'm speaking to husbands. Advocate loudly when your wife cannot, or your partner cannot. In the coming episode, we're going to explore culture, work, delayed care, faith pressures, racism, and invisible mental load that women carry. It's going to be an explosive season, so please do well to like, subscribe, follow me on all my platforms. Follow me on Facebook, I'm on TikTok. I'm also put them on the screen. I have the contact me if you want to share your Superwoman Syndrome. I have a lot of packed episodes for you, a lot of interesting stories for you, and looking forward to interesting and engaging podcast. Thank you for watching, everyone. Thank you for watching, and have a lovely day.